improving their mental health. Dr. Holly MacKenna with Dara Wellness joins us now to detail some tips on how you can actually do that. But, first, Dr. Holly, why has it become such a focus this year, you think?
Well, mental health is really a gateway to overall health. So when you improve things like mood, anxiety, we've actually found that it also improves your heart health, your gut health,
Sure.
pain perception. All these things are connected biologically, and also just you can feel that mind-body connection day to day. So it makes sense that this is really what people are starting to focus on, and I'm thrilled. I mean, this is part of why I do an integrative practice, is because I believe in that mind-body connection.
Right. So it's not that folks are neglecting their physical health by focusing on their mental health. By focusing on your mental health, you could be doing both.
Absolutely. You're 100% doing both, even if you don't realize it.
Okay, so if somebody has said this, but it's kind of abstract, I want to work on my mental health, what are some concrete things they can start doing to focus on their mental health?
Yeah, so they surveyed a group of about 2,000 adults, half of whom were young adults saying they wanted to focus on mental health as their primary concern. And of those folks, about 50% are doing meditation or some type of mindfulness.
That sounds nice.
And yeah, well, it does sound nice, and it's actually really good for you. So if you look at studies looking at both meditation and prayer, doing some type of practice actually does improve diabetes, blood pressure, heart disease, pain perception, overall well-being. All of these things are positively improved with having some type of practice like this. So this is a great one to start with.
For somebody who hasn't, tried meditation or tried it for very long, what are the benefits? Why does it help?
Well, the stress response is something that increases things like inflammation, blood pressure. And the stress response is that fight or flight response people might hear about, where your heart rate goes up, your breathing goes up. And it's really just your body preparing to do a segment on Fox 8 or to do,
Sure.
whatever it may be, to cook your favorite meal. But the brain kind of takes over and thinks that it's anxiety. The meditation or prayer actually builds up the relaxation response, which is the parasympathetic, the other type of or part of your neurological system. And when you're in that relaxation response, that's when your body has the time and space to get rid of toxins and build up positive things as far as building blocks and neurotransmitters and all the things that help us feel good.
Wow. Okay. So that sounds really beneficial. If you want to try it, how long each day should you be meditating?
Honestly, you can start just a couple minutes a day. You don't have to. It's kind of like walking outside. We talk about, having so many steps, but any movement is better than none.
Sure.
So I will often do, my favorite is like a 4-7-8 breath. So that's inhaling for a count of 4, holding for 7, and then exhaling for 8. And the main emphasis of that is exhaling for twice as long as the inhale.
Okay.
Because that builds that parasympathetic, the vagus nerve. People might hear all these like kind of buzzwords talked about in the wellness community.
Sure.
And that helps you get into that relaxation state. I teach that to folks. I say to try doing it 4 times. I'll do it sometimes in the morning if I'm having a day already. And it resets you. It really does. It really helps you get back into that calm.
7, in for 4, hold for 7, out for 8.
Absolutely. And that is a natural way to have an anti-anxiety response without having to look for, a pill or some other intervention. It's something that, it's like we're Dorothy with our red ruby slippers. Like, this is something we could be doing.
We can do. It's like a little magic that we have right here inside of us. Real quick, if somebody is focusing on their mental health and meditation just really isn't making them feel better, when should they seek professional help?
I'm a big fan, partly because I am integrative medicine as well, for people to just consider it part of their everyday health.
Okay.
I did a fellowship in integrative medicine, and something that really struck me, and integrative medicine is really evidence-based, up-and-coming, cutting-edge medicine, is that mental health was part of every specialty area, because we are finding more and more that there's serotonin receptors in the gut, in the heart, in all different areas of the body. And so really, it's something that should be considered a vital sign. And when you're unsure about maybe goals that you're working on or how you're doing, if your stress is getting to be too much, there's nothing wrong with just having an evaluation. I have lots of folks come and see me just for even a one-time evaluation for some guidance, to talk about what they can do for next steps. And it doesn't have to be this years-long engagement. It can be just a few sessions to kind of get you back on track.
Just like you see your regular primary care doctor once a year.
Absolutely.
Thank you so much, Dr. Holly MacKenna. Really appreciate the tips. We can all focus on our mental health.